All right, welcome to the deep dive where we kind of take those sources that you've all been sharing with us and try to boil them down to their core,
Hmm.
the real meat of the argument.
Yes.
And today's no different. Today we're diving into the fascinating and complex relationship between justice and access to healthcare.
Oh, okay.
And we'll be using the Stanford Encyclopedia of Philosophy as our guide for this.
That's a fantastic source.
Yeah, it really is.
Yeah.
I think it'll be particularly interesting to for our audience, who are, very much enjoy these deep philosophical questions.
Right, right.
So I guess where should we even begin? I mean, how do we even frame this idea of justice in relation to something as essential as healthcare?
Well, I think the core question, the one that really gets to the heart of it is universal access to healthcare a requirement of a just society?
Okay, yeah, that's a big one.
It really is.
Yeah.
And if so, what does that actually look like in practice? What kind of care are we talking
Oh,
about?
great.
And how do we justify it from a philosophical standpoint?
Exactly.
Fortunately, the Stanford Encyclopedia of Philosophy, it really lays out comprehensive framework for us to kind of unpack this.
It does, yeah. It raises a whole bunch of interconnected questions that we'll be exploring. Like, for instance, how have different societies actually tried to ensure access?
Right.
I mean, there's got to be a ton of variation out there.
Absolutely.
And then there's, something that we often take for granted. I mean, how do we even define what equal and equitable access mean?
Mm-hmm.
Those terms get thrown around a lot, but they're actually much more nuanced than we might think, aren't they?
You really are, yeah.
Yeah,
There's a lot of moral and philosophical baggage that comes with those terms.
absolutely.
Absolutely.
And then the real meat of the discussion, the philosophical arguments themselves.
Right.
What are the actual reasons, the justifications for why we might say yes, universal access to healthcare is a demand of justice? And within those arguments, what specific kinds of healthcare are we talking about? I mean,
Yeah.
is it just like basic necessities, or does it go beyond that?
Exactly.
Yeah.
Where do we draw the line? And then there's that fundamental question, do we even have a right to health or a right to healthcare?
Right. So many layers to unpack here.
There are.
Well, I think a good starting point might be to just to kind of get a sense of the lay of the land.
Okay.
What are different societies around the world actually doing when it comes to healthcare and access?
Well, it's pretty striking when you look at it.
Hmm.
Almost all wealthy, developed nations, they've actually implemented some form of universal health coverage.
Really?
Yeah, it's kind of a defining feature of these societies. They're committed to ensuring that everyone, regardless of their income or wealth, has access to at least a basic level of care.
I mean, that's pretty amazing when you think about it. It's a huge undertaking.
It is. It's a complex web of policies, funding mechanisms, and organizational structures, but the core principle is really quite profound.
It is, yeah. And I imagine there's a lot of variation in how they actually go about achieving this universal access.
Oh, absolutely. Yeah, there's no one-size-fits-all approach. Different countries have really tailored their systems to their unique historical, cultural, and political contexts.
Makes sense. So, what can you give us some specific examples?
Sure. So take Canada, for example. They primarily rely on general tax revenue to fund their healthcare system. It's what's often called a single-payer system, where the government is the primary payer for healthcare services.
Oh, okay. And I guess that contrasts with some European countries, right?
Right. Many European nations, they rely heavily on payroll taxes.
Yeah.
So it's more of a social insurance model where individuals contribute to a fund through their employment, and then they draw on those funds when they need healthcare.
Oh, interesting. So it's more directly tied to employment in those systems.
Exactly. Yeah.
And what about, other countries that might have a more mixed approach?
Yeah, good point. Germany is a good example of that. They have a mixed system that incorporates both public and private insurance. So individuals can choose to be insured through the government-run program or through private insurers.
Wow. So it's like a combination of the other two models we talked about.
Yeah, in a way. And, what's interesting is that these different financing mechanisms, they have different implications for how the financial burden is distributed across society.
Oh, right.
You
Yeah.
know, like, for instance, relying on general taxes, it's often seen as a more progressive approach, where those who earn more contribute more.
Okay.
Whereas payroll taxes, they tend to be less progressive because everyone pays the same rate regardless of their income.
I see, I see. So the choice of funding model itself reflects different values and priorities when it comes to social justice.
Exactly, yeah.
But I guess, even with all these different approaches to universal coverage, it doesn't necessarily mean that everyone has access to absolutely everything,
Right.
right?
That's right. That's a really important point.
Yeah.
Universal access doesn't automatically translate to unlimited access. The specific benefits that are covered can vary quite a bit from country to country.
Right, right. I mean, we've all heard stories about, people traveling to different countries to get specific treatments that aren't available or covered in their own.
Exactly. It's not a simple yes or no answer.
Right.
When we say universal access, we're really talking about access to a defined set of benefits, a package of services that the system has deemed essential or necessary.
Okay, that makes sense. So it's more about ensuring that everyone has access to a certain baseline level of care rather than guaranteeing access to every possible medical intervention.
Exactly, yeah.
Can you give us some examples of, how these benefit packages can differ?
Sure. So one area where you see variation
Mm.
is in coverage for prescription drugs. Some countries might cover a wider range of drugs or have more generous reimbursement policies than others.
Right, right.
For example, let's look at Canada again. Their national health insurance system, it covers inpatient prescription drugs. So if you're in the hospital, your medications are covered.
Mm.
But outpatient drugs, the ones you take at home, those are handled at the provincial level.
Oh, interesting.
Yeah, which means there's a bit of a patchwork of coverage across the country.
I see, I see. And what about other types of care, like long-term care, for example?
Yeah, that's another area where you see variation. Long-term care, which includes things like nursing home care and home health services, it's not always universally included in these systems.
Wow. So even in countries that are considered leaders in universal health coverage, there are still significant gaps and limitations.
Right. And it highlights the fact that there are always going to be ongoing debates and difficult decisions about what to include and what to exclude.
Absolutely.
The Stanford Encyclopedia of Philosophy,
Yeah.
it actually points out that even in the U.S. with Medicare, which is a federal program that provides health insurance to seniors and people with disabilities,
Mm.
um, they didn't originally cover outpatient prescription drugs.
Really?
Yeah, that was added later through the Medicare Part D benefit. So
Yeah.
it's an evolving process.
It is, yeah. It makes you realize that achieving universal access is not just a one-time event. It's a continuous effort to adapt and expand coverage to meet the changing needs of the population.
Absolutely, yeah.
So it's not just about the wealthy countries, right? I
Yeah.
mean, this movement towards universal coverage, it's spreading to other parts of the world as well.
Oh, definitely. Yeah, it's really encouraging to see that middle-income countries like South Korea, Taiwan, Thailand, Mexico, they're all making significant strides in implementing universal health coverage systems.
Wow, that's great.
Yeah, they're experimenting with different models, adapting them to their own specific contexts.
That's fantastic.
And the World Health Organization, the WHO, they've really been a champion for universal health coverage on a global scale.
Yeah.
They see it as essential for achieving better health outcomes and reducing health inequities worldwide.
Yeah, that makes sense. So it seems like there's a growing global consensus that universal health coverage is a desirable goal.
Yeah, there is. It's gaining momentum. But, a key challenge remains the comprehensiveness of these benefit packages.
Oh, right, right, yeah.
Are they what we call thin, providing some minimal safety net, leaving individuals with substantial out-of-pocket costs?
Okay.
Or are they striving to be thicker, covering more people, a wider range of services, lower levels of cost sharing?
Right.
It's a big question. It involves significant ethical trade-offs about how comprehensive a basic level of care should be.
And it probably ties back to those philosophical debates we were talking about earlier, right? About what we owe each other, what justice demands in terms of healthcare.
Exactly, yeah.
Well, speaking of different approaches, I think it's worth taking a closer look at the United States because historically it's really stood out among wealthy nations for its lack of universal health coverage.
Right.
And it's led to a situation where you have a significant portion of the population without health insurance.
Absolutely, yeah. The U.S. has really taken a different path.
It has.
For a long time, it's really prioritized a market-based approach to healthcare,
Yeah.
relying heavily on private insurance. And, that's created some real challenges in terms of access and affordability.
It has, but I mean, there have been efforts to address this.
Oh, yeah, definitely.
Yeah.
And the biggest one in recent history was the Affordable Care Act, the ACA.
Right, right.
Act.
Obamacare passed in 2010.
Exactly. That was a major attempt to expand health insurance coverage and move the U.S. closer to universal coverage.
It was, yeah. And it did make some significant changes, didn't it?
Oh, it did. Yeah, it introduced a number of key provisions, like the individual mandate, which required most people to have health insurance or pay a penalty.
Right.
It expanded Medicaid, which is the government health insurance program for low-income individuals.
Mm-hmm.
And it set up insurance exchanges, which are online marketplaces where people can shop for and compare health insurance plans.
Okay. So it sounds like it was a pretty comprehensive reform effort, but did it actually achieve universal coverage?
Well, that's where it gets a little bit more complicated.
Yeah.
The ACA did make significant progress in reducing the number of uninsured Americans,
Okay.
but it didn't achieve full universality.
Why not?
Well, for a couple of reasons. One, the Supreme Court, they ruled that states could opt out of the Medicaid expansion.
Oh, right.
And that meant that in some states, many low-income adults remained ineligible for Medicaid.
I
So
see.
that created some geographical disparities in coverage.
Got it.
And then the ACA, it explicitly excluded undocumented immigrants from being eligible for coverage.
Right, right.
And that's a substantial population in the U.S.
And, this kind of exclusion, it's actually quite common in many other countries with universal coverage as well.
Really?
Yeah. It's a complex issue. There are a lot of different political and social factors that play into these decisions about who gets included and who gets excluded.
That makes sense. It's not just about the mechanics of setting up a healthcare system. It's also about these broader social and political debates about citizenship, belonging, and who deserves access to essential services.
Absolutely. And it raises some really important ethical questions.
It does, yeah. And it underscores the fact that achieving universal access is not just about enacting legislation. It's about addressing these deeper social and political divides.
Mm-hmm.
And even when people do have insurance, I guess it doesn't necessarily mean they have true access to care, right?
That's right, yeah. And the Stanford Encyclopedia of Philosophy, it really emphasizes this point.
Yeah.
Having insurance coverage on paper is one thing, but actually being able to access the care you need when and where you need it, that's another thing entirely.
Right. So what are some of the other barriers that people might face even if they have insurance?
Well, there are a whole host of non-financial barriers that we need to consider.
Yeah.
Things like discrimination
Oh, right.
based on race, ethnicity, gender, sexual orientation. All of these factors can create obstacles to care.
Absolutely.
And then there are geographical barriers.
Yeah.
If you live in a rural area or an underserved community, you might have limited access to healthcare providers or facilities.
Right, right. I've heard about that, especially when it comes to specialty care.
Exactly. Yeah, you might have to travel long distances or wait extended periods of time to see a specialist.
And language and cultural differences can also be a barrier, can't they?
Absolutely.
Mhm.
If you don't speak the dominant language, or if your cultural beliefs and practices around health and illness are different, it can be really difficult to navigate the healthcare system and feel comfortable seeking care.
Those are all really important points. It seems like achieving truly equitable access to healthcare requires us to think beyond just financial barriers and consider all of these other social and structural factors that can create disparities.
Absolutely, yeah. It's about addressing systemic inequalities
Mm-hmm.
that permeate our society. For example, there's a ton of research in the U.S. that shows that even when you control for things like insurance and income, racial and ethnic minorities often receive less intensive treatment for certain conditions.
Really?
Yeah, there's evidence of disparities in the quality and quantity of care that people receive, even within the same healthcare system.
Wow, that's pretty alarming.
It is, yeah.
Yeah.
And it points to the fact that, simply having universal coverage isn't enough.
Right.
We need to address these underlying biases and inequities that are baked into our social structures.
That's a really important point, and it brings to mind some of the classic research on health inequalities, like the Whitehall studies that were conducted in the UK.
Oh, yes. Those are very insightful studies.
Yeah, and what's striking about those studies is that they were conducted within a system that was specifically designed to provide universal access to healthcare,
Mm-hmm.
the National Health Service in the UK.
Right.
And yet, despite that, the studies found persistent health inequalities across different socioeconomic groups.
They did, yeah. The Whitehall studies followed a large cohort of British civil servants over many years,
Okay.
and they found that those in higher grade, higher paying jobs had significantly better health outcomes than those in lower grade jobs, even though they all had access to the same healthcare system.
Wow. So even when financial barriers are largely removed, these health inequalities linked to socioeconomic status still persist.
Exactly, yeah.
What do you think explains that?
Well, the researchers, they look at a whole range of factors, things like lifestyle choices, smoking, diet, exercise. And while those things did play a role,
Okay.
they couldn't fully explain the disparities. What they found was that a lot of it had to do with differences in psychosocial factors. Things like stress, job control, social support, all of these factors that are influenced by your position in the social hierarchy.
I see. So it's not just about your access to medical care, it's also about the broader social and economic conditions that shape your health and well-being.
Exactly. It's about the social determinants of health. The Stanford Encyclopedia of Philosophy uses that term to refer to these broader social, economic, and environmental factors that influence health outcomes.
Right, right. And the WHO Commission on Social Determinants of Health, they've really highlighted the importance of addressing these underlying factors to effectively reduce health inequities.
Absolutely, yeah.
Yeah.
They've called for a more holistic approach to health, one that recognizes the interconnectedness of social, economic, and environmental factors.
Yeah. It's a powerful reminder that achieving health equity requires us to think beyond just healthcare and address these broader societal issues.
Exactly. It's a much bigger challenge, but it's essential if we're serious about creating a more just and equitable society.
Well, I think we've done a pretty good job of laying out the complexities of what access really means, both in terms of having insurance and in terms of actually being able to get the care you need.
Yeah, it's not a simple issue.
It's not. But I think for our audience, who I know are really interested in these philosophical questions, it's important to delve into how we even conceptualize and measure this idea of access to care.
Absolutely, yeah.
It's not just a matter of counting heads, is it?
No, it's not. The stated goal, is often equal or equitable access to needed care. But defining what equal and equitable mean in this context, that's where things get really interesting.
Right, because it's not as straightforward as it might seem at first glance.
Right. We might initially think of equal access as a simple matter of distributing resources equally. But when you start applying it to healthcare, you quickly realize that it involves a lot of moral considerations.
Right, because what might seem equal in one sense might not actually be fair or just in another sense.
Exactly.
Yeah.
The Stanford Encyclopedia of Philosophy, they give this great example about a coffee lounge.
Okay.
And they ask, is access to coffee truly equal if there's no ramp for someone in a wheelchair?
Oh, right.
Even if someone offers to bring them coffee? What about differences in distance or even someone's preference for the decor?
Interesting. So it's showing that our understanding of equal access is tied to our understanding of what truly matters in that context.
Exactly. And then the same holds true for healthcare.
Okay. Yeah, that makes sense.
Our judgments about what constitutes equal access, they're deeply intertwined with our moral beliefs about the significance of health and healthcare and human flourishing.
So it's not just a technical question, it's a philosophical one.
Precisely. And even a basic understanding of equal access, like removing obvious barriers like financial constraints or geographical distance or discriminatory practices, that already implies a certain moral ideal, which is that individuals with comparable health needs should have comparable opportunities to receive appropriate care.
Right. And it seems like equitable access is even more complex.
Oh, it is. Yeah, the Stanford Encyclopedia of Philosophy, they point out that among researchers, the dominant view of equitable access is what's called use per need.
Use per need, okay.
Yeah. The idea here is that utilization of healthcare services should reflect actual health needs.
Right.
It shouldn't be distorted by systemic or individual factors that are unrelated to those needs.
Oh, okay, that seems logical. Can you give us an example?
Sure. So imagine you have two groups of people with similar health needs. But one group utilizes healthcare services at a much lower rate than the other group.
Okay.
And the reason for this difference isn't because they have different health needs. It's because of something else.
Right, like maybe they face transportation barriers or language barriers or something like that.
Exactly, yeah. Or maybe they're just less knowledgeable about the healthcare system or have lower health literacy. And so they're less likely to seek care, even when they need it.
Right. So in that case, even though everyone technically has access, the access isn't truly equitable because certain groups are being systematically disadvantaged.
Exactly. So from a use per need perspective, that would be considered an inequity.
Makes sense. But I imagine there are some critiques of this approach, right?
Oh, there are, yeah. Critics, they argue that it's overly focused on utilization rates
Okay.
and doesn't necessarily take into account the quality or effectiveness of the care that's being received.
Right. Right. Because just because someone is using healthcare services doesn't mean they're getting the care they actually need or that it's actually improving their health.
Exactly. There's also the concern that focusing solely on utilization might overlook important process-related factors, like waiting times, for example.
Oh, right. Right.
Someone might eventually get the care they need,
Mm-hmm.
but if they have to wait an excessively long time, that can be a real burden,
Absolutely.
and it can exacerbate existing inequalities.
Right. So it's not just about whether people are using services, it's also about the conditions under which they're accessing those services.
Exactly. And another critique is that the use per need approach doesn't really tell us anything about why these disparities in utilization exist in the first place.
Okay. Yeah, because it's more of a descriptive measure than an explanatory one.
Right. It can help us identify inequities,
Mm-hmm.
but it doesn't necessarily tell us what to do about them.
So we need other frameworks to help us understand the root causes of these disparities.
Exactly.
Yeah.
And there are other perspectives out there, like the modified market view, for example.
Okay. The modified market view. And I guess this is where we start to see some of those different philosophical approaches coming into play, right?
Right. This view has been particularly influential in the U.S.,
Mm-hmm.
and it's based on the idea that a just healthcare system should ensure a decent basic minimum of care that's accessible through the market.
Okay, so it's still a market-based approach,
It is, yeah.
but it's not a completely unregulated market.
Right. It's modified in the sense that it recognizes that the healthcare market often deviates from the ideal of perfect competition.
Right, because there are all sorts of complexities and information asymmetries in the healthcare market that make it different from, say, the market for consumer goods.
Exactly. So the modified market view acknowledges that there might be a need for government intervention to correct market failures
Okay.
and to ensure that everyone has access to this basic minimum level of care.
So what might that intervention look like?
Well, it could take various forms. Things like subsidies to make health insurance more affordable,
Mm-hmm.
or regulations to prevent insurance companies from discriminating against people with pre-existing conditions,
Right. Right.
or maybe even public provision of certain essential services like emergency care.
I see. So it's a mixed approach that tries to balance the principles of market efficiency with the goal of ensuring a basic level of care for everyone.
Exactly. And it also acknowledges that, a truly just healthcare system requires a reasonably equitable distribution of income.
Oh, right, because if people can't afford even the basic necessities of life, they're not going to be able to access health care, even if it's technically available to them.
Exactly, yeah. So it's not just about healthcare itself. It's about the broader social and economic context.
And then there's the choice model,
Mm-hmm.
which seems to place a lot of emphasis on individual autonomy and the freedom to choose.
Yeah, it does. This model has been particularly popular among some conservatives in the U.S.,
Right.
and it really emphasizes individual choice as the key to achieving universal coverage.
Okay, so how does that work in practice?
Well, the basic idea is that instead of mandating health insurance coverage, like the ACA did,
Mm-hmm.
the government should focus on making it easier and more affordable for individuals to choose to buy insurance.
Okay, so it's about creating incentives rather than imposing requirements.
Exactly. They argue that people should be free to decide whether or not they want to buy insurance and that the government shouldn't force them to do so.
Okay. But, I mean, doesn't that raise the issue of free riders? People who choose not to buy insurance but then end up using the healthcare system when they get sick or injured.
Yeah, that's the big challenge with this model.
It is, yeah.
If enough people opt out, it can lead to higher costs for those who do buy insurance,
Right.
and it can put a strain on the system as a whole.
So how do proponents of the choice model address that?
Well, they typically advocate for some combination of subsidies to make insurance more affordable,
Oh, okay.
and maybe some limited penalties for those who choose not to buy insurance.
Right. So it's about trying to strike a balance between individual freedom and the collective good.
Exactly, yeah.
Well, it's fascinating to see how these different perspectives on healthcare access reflect different underlying values and beliefs about the role of government, individual responsibility, and social justice.
It is, yeah. And it's important to keep in mind that these are just three of the many frameworks that have been proposed.
Right, right. It's a complex and constantly evolving debate.
It is, yeah. But one that's essential to have
Yeah.
if we want to create a healthcare system that's truly just and equitable.
Absolutely. And I think it's important to connect these different frameworks back to the issue of racial inequalities in health and healthcare,
Mm-hmm.
because we've already seen that these inequalities are pervasive, they're complex, and they're driven by a whole host of factors.
Right.
But how do these different frameworks help us understand and address those inequalities?
Well, I think it's important to note that none of these frameworks necessarily explain the root causes of racial health disparities.
Okay.
They don't really get into the historical and systemic factors that have led to these disparities in the first place.
Right. They're more focused on how the healthcare system should respond to these disparities rather than on how to prevent them from arising in the first place.
Exactly, yeah.
So it's kind of like they're operating at different levels of analysis.
Right. But they can still offer some insights into how we might address these inequalities within the context of the healthcare system.
Okay.
Like, for instance, the use per need approach. It would identify differences in healthcare utilization between racial groups
Mm-hmm.
that aren't explained by differences in health needs as potential inequities
Right.
requiring attention.
So if, for example, we see that Black Americans are less likely to receive certain types of preventive care than white Americans, even when they have similar risk factors,
Mm-hmm.
that would be a red flag
It would, yeah.
that something's not right.
Exactly. And it would suggest that there might be barriers to access or biases within the system that need to be addressed.
And what about the modified market view? How would that approach think about these racial disparities?
Well, the modified market view might attribute some of these disparities to differences in individual preferences or choices,
Okay.
or to market dynamics that disadvantage certain groups.
So, for example, if Black Americans are more likely to live in areas with fewer health care providers,
Mm.
or if they're more likely to be offered lower quality insurance plans,
Right.
that would be seen as a market failure that needs to be corrected.
Exactly, yeah. The focus would be on creating a more level playing field
Right.
so that everyone has a fair chance to access the care they need.
And the choice model, I guess it would probably view these disparities in terms of individual choices.
Right. It would likely argue that differences in insurance coverage levels
Mm-hmm.
or utilization patterns are largely the result of individuals making different choices
Okay.
based on their own preferences, beliefs, and circumstances.
So if, for example, Black Americans are less likely to buy health insurance,
Mm-hmm.
the choice model might attribute that to cultural factors or to a distrust of the healthcare system.
Right. Or maybe to a lower level of risk aversion,
Hmm.
a belief that they're less likely to need expensive medical care.
Okay, I see. But, that explanation seems a bit simplistic, doesn't it? It doesn't really acknowledge the historical and systemic factors that might be shaping those choices.
Right. And that's a common critique of the choice model.
Hmm.
It often overlooks the broader social context and the
Mhm.
ways in which individual choices are constrained by structural forces.
So it seems like each of these frameworks offers a different lens through which to view these racial health disparities.
Yeah, they do. And they all have their strengths and weaknesses.
Right.
And ultimately, I think it's important to consider all of them
Hmm.
and to try to develop a more holistic understanding of these complex issues.
Agreed. And that brings us to, I think, the core philosophical question that we've been dancing around this whole time.
Yeah.
Does justice actually require universal access to healthcare?
Ah, yes. The big question.
It is, yeah. And the Stanford Encyclopedia of Philosophy, it outlines 3 main lines of argument in support of this idea,
Mm-hmm.
while also acknowledging that there are other perspectives, like libertarian views, that would generally reject this notion of a redistributive obligation when it comes to healthcare.
Right. And those libertarian views, they often emphasize individual liberty and limited government intervention.
Okay.
So they're more skeptical of the idea that society has a duty to ensure everyone has access to health care.
Right, right.
And they would typically argue that it's up to individuals to provide for their own health care needs.
Makes sense. But let's focus on those arguments in favor of universal access, because I think those are the ones that are really relevant to this discussion.
Okay, great.
So what's the first main argument?
So the first argument connects health, opportunity, and universal access.
Okay.